Hi, hello. I'm Paul. Um, I'm due to have a Nevro HT10 spinal stimulator implanted on Monday. Today is Saturday, the 9th of February. I'm having the operation on the 11th. When I was doing research into whether or not to go for a Nevro spinal stimulator, I didn't find an awful lot of recent stuff, especially people's experiences and how they got to where they've got to. So I decided to do this video diary. So hopefully I'm going to do some videos as I progress through my recovery with the HT10, and I'll let you know how it goes. My own journey here started 2016 with a prolapse disc. I had surgery on that to remove the prolapse, and recovery thereafter was physio and still medication. I ended up with a little bit of drop foot and weakness in my left leg. Same L5S1, prolapsed again in January 2017 or the end of December 16, at which point I was waiting for a spinal fusion to be done in Taunton at the Musgrove Park Hospital. I didn't make it for the fusion. The prolapse got so bad that I ended up with a cord equini, so I had to have emergency surgery and then taken to Musgrove Park, where I had further surgery to remove some blood clots and fragmented disc. So I've been left with nerve damage and constant pain in my legs. So I've been through the journey that everybody else, I'm sure, has gone through or thinking about going through with the mindfulness, which helps. I've done the pain management program, which gives you some great tips on how to cope with your pain, and medication. Medication wise, I'm on pregabalin and tramadol. I've come off amitriptyline and all the other concoctions that they give you. I'm down to 300 milligrams of pregabalin per day and 200 to 300 milligrams of tramadol. So still quite high doses. So that's where I'm at. I've been referred for the HT10, and I saw the doctors at the Royal Hospital for Neurology and Neurosurgery in Queen Square, and they agreed that I would be benefit, or I would get benefit from the HT10. I've done the APL course, which you have to do, which is a 4-day, over 4-week period course, and that covers most of what we've already done in the pain management program. It gives you great insight into how to manage your pain, how to manage flare-ups, which you'll still get with a spinal stimulator. The spinal stimulator is not going to be the be-all and end-all and get you back to normal. How to reduce medication. They show you the equipment on how it goes in, where it goes, and how to manage it. And then you cover your goals and values. So goals that I'm looking forward to when I have pain reduction. They've mentioned figures between 30 and 50% pain reduction, which, to be honest with you, I'll take all day. And hopefully that will halve my medication, if not better. I've heard great stories of 70 to 80% pain reduction, and I've heard stories of no pain reduction. So it's going to be individual to everybody how it works. So the operation, I have to be at the hospital 7:30 Monday morning. Operation surgery times normally about 3 hours. I'm having a 1-stage surgery, so that means the implant is going straight in, and I get the battery pack implanted into my buttock. I'm not having the trial. Some of my colleagues that were on the course are doing the 2-week trial, so it's where you wear an external battery pack and you see how you get on over 2 weeks. After the 2 weeks, the whole thing is removed, and then if you decide to go forward for a permanent implant, you have to wait additional 6 weeks. My doctor said he's not going to double the risk of infection. I am going to get benefit because of the state of my back, so I'm just going for 1 stage. I'm going straight in for it. So we'll see how it goes. I get back on here, hopefully day after surgery. I'll let you know how I'm feeling. All right, take care. Okay, this is the day of surgery. It's about 4 or 5 hours since I had the implant put in, and the Nevro rep going through all the programs. I am uncomfortable, especially around the site where they've put the battery, and at the base of my spine where the wires were put in. It's uncomfortable, but bearable. The Nevro rep was brilliant. She programmed me and gave me a guide of what I have to do. And over the next 6 weeks or so, I'll end up playing with all the programs and numbers from the programs, and finding out where it sits best for me. Tomorrow I'm meant to be in a lot of pain, but we'll see. We'll take it one day at a time. Staff at the hospital today were fantastic. Couldn't be any more helpful. A bit chaotic this morning going there, but that's just because of the number of people they had turning up. So there we have it. I'll check in again tomorrow, let you know how I'm doing, and then we'll go from there. All right. Thank you.